This Docs on Call is brought to you by Excel's Blue Cross Blue Shield. I'm joined today by Dr. Micah Lissy, a sports orthopedic surgeon with UHS, and we're here at Union Endicott High School to talk about Achilles ruptured tendons. Now, what is that and what does it look like?
An Achilles tendon rupture, if I may, I'm going to use my model here. This is Kara Gorgos, who's our UHS sports medicine athletic trainer here at Union Endicott. And this is her foot, and way at the back of her foot, this tight cord back here that you can sort of see me bouncing on, that's the Achilles tendon. And the Achilles tendon is in charge of pushing the toes down. It connects the calf to the heel.
Now, how would I know if I ruptured my Achilles tendon?
First and foremost, you'll likely hear a pop. A lot of people say, I heard a loud pop, and then I turned around to see who kicked me or who hit me in the back of the calf with a baseball bat, and then no one's there. So it feels like a little explosion in the back of your calf. There's likely some bruising and some pain, and you lose a lot of strength in terms of pushing your toes down. Those are the signs.
Well, who does this happen to usually?
Not Kara. It's usually, 30, 40-year-old male who's a weekend warrior. Sometimes there can be a relation to some strong antibiotics you've been on or multiple corticosteroid injections, but those are typically the signs.
What is the treatment for when this could happen to you?
If you get to it right away and you really want to avoid surgery, there's good research that you can treat this with a cast. And you can do well. It's just a long period of time. I think in the athletic population and the athletes I see, they do very well with a surgical repair, and whenever possible with my athletes, I tend to do a minimally invasive approach, which decreases all sorts of risks, and I think that's a good way to go.
All right, Dr. Micah Lissy with UHS, thank you for joining us today. If you have any questions or concerns, you can call 584-7362, 584-7-DOC.